Parker Centre is actually the flagship of a group of centres, frail care centres. We started off in 1961, originally as part of the Dutch Reformed Church, or most commonly known as the NG Kerk. They decided, due to people, single people, females especially, living in the environment in the city, that needed support. And they decided on an old age home as we know it in the old days. Normally a place where you can provide a structured living with a manager or a matron and a little bit of a nursing care, but mostly the services that was provided was the cleaning, the washing and food services in, as we call it, serviced rooms. Then in 1961 they bought this building that was originally the Park Lane Clinic, built in 1909. So we have a lot of history behind us. Old buildings that need a lot of upkeep due to their age. After they've bought and converted this place, they also start immediately building one of our buildings. These days we call it Jacaranda. They completed that by the end of, I think, in 69 eventually, but the original building started in 1962. And from there on, they also built a hall on the premises for the activities. Moving on in 1987, they built Petria, also named after a plant that we found here on the premises. And in 2003, we built our dementia section. That's a dedicated dementia section. There, that building's name is Forget Me Not. Just again a flower name, but also in the Alzheimer and dementia section, Forget Me Not is associated with dementia. So for us that is very important. Part of the original buildings had the nursing sisters building as well, not only the hospital, but where the staff used to live. That was converted and called these days to Villa Rosa. So we have quite a number of old buildings, younger ones, and there's more or less 12 sections or wards on this premises, because some of the buildings have 4 floors, some, like in the dementia section, has 3 floors, there's 3, and then some only have 2 floors. Obvious, when we listen to the news, we learn about it in Europe, especially the fast spread of it, and we expected that South Africa will also have a number of COVID patients. We being a place for older residents, we were very, very worried. So as early as late January, beginning of February, we start ordering stock in terms of sanitizing and to increase the hygiene regimes here to make sure we will be ready. Also masks, because at that stage you didn't know what you're actually going to need. Already we found it difficult to source those products. Then by the time the lockdown started on the 27th of March, we thought we were prepared. But we learned quickly we might have prepared in practical terms, but we were not really prepared for the emotional impact, especially on the residents, but also on the staff. You can understand that. So also Due to the lockdown regulations, we work with a skeleton staff in our office block, but the nursing staff we could not make less. Also the same for the cleaning staff, because that is part of the care that we provide, and obvious you have to have a place that's absolutely hygiene to prevent any contagious disease, well, whether it's COVID or anything else.
I used to work for a family and childcare organization, but I've made the choice to change. So I moved from children to the elderly people. I love them. They feel like my children. They are so vulnerable, and I really feel I'm the voice that can talk for them. You know, as a social work manager, I'm responsible to manage the social work team, but I'm also part of the day-to-day managing of the center. So my task is huge, and I'm responsible for many things. But I think my major function here at Parkheer is to do new admissions. So from the time people inquire, before the admission, on admission day itself, and then also after admission, I work with the residents and with the families. And then from there on, between me and Chantal, the other social worker, we divide the residents into two groups. So I'm responsible for plus minus 150 of them, and she for the rest. We have 300 at the moment, about 280, but in total we can accommodate 320 residents. You know, our residents, we have residents from all races, all cultures, all beliefs, religions, non-believers, Jews, Muslims, Hindus. We really have them all. And I can honestly say we've never had any incidents where there's any tension among the residents in terms of culture or race or religion. They are actually very tolerant, the residents and their families. You know, we've decided to also admit younger people. So at the moment we have about 50 people younger than 60. I think our youngest is about 32 years old. We've decided to also admit younger ones because there are no resources out there for younger people. So we really cater for people that needs mid-care, frail care on different levels, and dementia care on different levels. We have people that's physically very well, but mentally they suffer. We have people with psychological problems, depression, bipolar, schizophrenia. We have illnesses such as Huntington's, Parkinson's, MS. So we really cater for everybody. And people coming to Parkheer, most of them, I will say 95% of the residents coming here stay here till the end, because we can move them from one section to the next if needed. You know, here at Parkheer we really celebrate all the big days. We start with Valentine's Day in the beginning of the year, then we go through Mother's Day, Father's Day, Spring Day, Heritage Day, Mandela Day. But because of COVID, the events are also, we are very restricted in what we can do. So during October we spoil the residents, mostly with nice eats. They love the sweet things. So we hand out many eats during the month. We had many music and movement days. We even went to the wards because not all of them can come out. Then Chantal also runs, she can maybe elaborate on that. She does little things like arts and crafts, and the ladies knit, even some of the males also knit. So we always spoil them, but I think in October we had more extra special days with more sponsors who got involved, handing with eats and nice treats for them.
My role is at Parkheer is mostly to support the residents, communicate with families, as well as facilitate the active aging program, or activity program, because we have a lot of younger residents as well. So it's to ensure that people are as well adjusted, as happy as possibly can be. I think that is our goal. People leave behind a lot to be here. they have to be here for the support or for the nursing, but in doing so they have had to leave behind family homes, pets. So to come here usually involves a lot of loss, and because of that it's usually quite emotional and difficult for people to adjust, especially initially. And because of that, the social work team is very active at Bake, trying to counsel the residents through this very difficult phase, and adjusting here and understanding, you know, though you are here and you've had to leave so much behind, that every day you get up for a reason. There's something that you can get up for, and that we try and motivate people to find joy in the little things: music, friendship, gardens, in the activities that we do. So we counsel the residents as well as their family members. With the families, it's often, you know, a case of feeling very guilty about bringing a loved one to Bake. It's never easy. It is not like going shopping, you know. When a person is admitted at Bake, there is a lot of support required for the residents as well as the family, and that is why social workers here at Bake are extremely important, and our role here is definitely about making sure that the resident and the family members are as well as possible. So I'm a social worker. I've been here 12 years, and I've seen a lot of changes over the years. There's been a shift from mostly frail older persons to more younger residents who would need support for different kinds of reasons. So it's about assisting holistically and supporting people who need assistance with a range of challenges, medication, health, and so forth. So 12 years ago, you would see an older, more frail resident population. Now with the younger people, the challenge is also, as my role is to motivate people to become more active, stimulated, you would have to adjust the activity program as well to make sure that for every level of need, we have something that is enjoyable and stimulating. For instance, we cannot facilitate the same activity for people who are in high care and have a limited ability, and we cannot take that same activity and facilitate with a group of younger residents who are very able. So we are constantly adjusting our activity program to ensure that there's something stimulating and fun for everybody. Because of COVID, we have been impacted in what we can offer in terms of activities, of course. So before COVID, we would have a varied and full program of activities. Daily there would be activities in the hall. We would take it to the wards, in the dining rooms, outside, on the lawn. But unfortunately with COVID, that's had to change. We've had to adjust. So that's why you saw us dancing on the lawn just now. So we can still keep social distancing. Gathering in groups outside is still safer, and then we can still make sure that there's a lot of fun. We use a lot of music. Music is so important in what we do here. The music center in the brain is situated very close to the memory center. So it uses a different pathway to recall memories, and not just normal memories. It's usually very emotionally laden memories. So music is extremely therapeutic. And people, say for instance with advanced dementia, when they hear a song that they know, though they can't walk or speak anymore, will try and sing along, and they will tap to the beats. So the music capacity in the brain is retained to the very, very end, no matter how frail a person. So music for us is cardinal in what we do here. and we use it often and as much as possible. Dementia is a cognitive disease, and sometimes there is confusion about the difference between, say, psychiatric illness and a cognitive disease. So where a psychiatric illness is not necessarily, dementia is definitely a disorder of the brain. So if you were to do scans, you would see that there is a problem. It usually shows up in brain scans. Dementia takes many different forms. It's got many different names and diagnoses, but basically it impacts the capacity of a person. And it usually means that there is deterioration over time, and that would be insight, judgment, ability to appreciate things, memory, cognitive capacity, reasoning, and for that reason, persons with dementia, especially in the more advanced stages, would need a lot of nursing care and help and supervision. And often it is no longer possible for such a person to remain at home, where the family often have to work or often cannot understand or come to terms with the deterioration. So there's a lot of strain on relationships at home. And we often see, once a person is admitted to parquet in a special section, with the support and nursing care, you would see a restoration in relationships between family and residents. It is extremely stressful to take care of someone with advanced dementia. It is not something that ever goes away. You do not have a break, day or night. You cannot take a weekend off or a holiday. Taking care of someone with advanced dementia is 24/7. So often there is no choice in bringing someone here. So a person with dementia, when we place them, we consider the advancement of dementia, social ability. That is very important. The fact that someone has been diagnosed with dementia does not mean that they cannot be placed in a section with people who do not have dementia. But what it would mean is, if social ability has been impacted, or that person's dignity is at stake, we have to protect them in a secure section for people with dementia, where there is a specialization in taking care of the needs of people with dementia. In the dementia section as well, we offer a lot of stimulation, and often it involves music.
As manager, we just look after the patients and the nurses, just to deal with all the problems and try to solve them, all of them, try to keep everyone satisfied. With the nursing, what I do on a day-to-day basis, it's very difficult, with all nursing related things. There's no fixed pattern. Whatever you put on your day-to-day book, it's not going to happen, because there's always little crises and problems we have to solve, whether it be medication, whether it's difficult patients, whether it's family, relatives, queries, whether it's all to do with patient care. That's what we basically deal with. And then also, of course, the individualize patient care, like every patient is different. You get a lot of people that maybe have dementia, but every dementia person is also an individual person. So all the treatment doesn't work for all the people all the time. So the nursing staff and also especially in dementia care, sort of are also in partnership with the doctors to find out the correct treatment for this specific patient who suits this patient the best. It's a little bit challenging. It's sometimes more challenging than anything else to get really the treatment for the right treatment for the right person. But most of the time we succeed. So I'm very proud of my nursing team. I've got a brilliant nursing team who really, really care for the patients. It's a bit of a problem. Sometimes we would like to give every patient an individual person to care for them, because that's the ideal. We don't live in an ideal world, so we really do the best we can with the persons we have here. But again, I've got a very good nursing team. Sometimes we do make mistakes. We're humans. But luckily, the mistakes get fewer and fewer and fewer. And that's just it. It's no use I'm telling you we're perfect, because we're not. But we want to be the best place in the world. We want to give the best care for our people, especially with dementia. To show a caring attitude, to show no matter what you were before you came here, we now care for you.
My name is Magdalene Jacobs. I'm a resident here at Parquet. People don't usually talk about their age. I am 73 years of age. Coming here, if you look at me now, and the sister is sitting next to me, everything was black. My eyes, everything, I was really down. And not for one day, I'm sorry that I am here. I don't regret that. For where I've come from and how I looked up to where I am now, being the person I am now, that really boosted me to become what I am now. She's a very caring person, and when she says something, it's not just something. She knows what she's doing, and if she asks you, how do you feel, and you explain to her, but this is the way I feel, she'll tell you, you know what, you need to see a doctor. And she was never wrong, because when you go to hospital, you find out there's stuff that you didn't even know about. And then you get treated, and she sees that the staff that works under her. Leaving my home for anybody, it's you think a lot. Am I doing the right thing, even if you're on your way here? But when you come here and the people get connected, I'm talking about the staff, get connected to you, then you feel this is where I want to be. This is what I want to do. It's actually somebody that's living out of a bucket list. You see, what am I going to do next? What's going to happen next? And we do have a fixed program, but because of the COVID we have, we can't, but they do everything. Every day there's something to be done. It's not that we are sitting and thinking, okay, our people can't come in here, we don't see our children, and what's going to happen now? It all depends how you feel, and it all depends whether you want to participate. If you want to participate, you're going to feel a very happy person. Other than that, no, you're not going to feel happy, because then it's your own indaba, as they say, because you're not participating. The one activity I really liked was OT. So that's where you work with your hands. I made a lot of necklaces and earrings, and we make cake, we make sweets, we knit, we do Madiba Day, sending out blankets and all that stuff, because it's a lot of us that attends it and does it. So you feel part of the outside world, even though you're not working, even though you're not staying outside. And then we have there's a chapel, and every week there's somebody else that comes in, a different religion. It all depends on yourself whether you want to attend or not. It's nobody's forcing you. On Sundays there's also church. We have communion, and we do have ministers coming in. Even though it's COVID, they make sure that when they come in here, they can come in here. It's not just that they allow them, but it's the usual group that usually comes to us, and we know them very well.
For more stories like these, go to www.social-tv.co.za, subscribe to us on YouTube and follow us on our social mediums.